As Nigeria moves closer towards reaching the UNAIDS 95-95-95 fast-track strategy, monitoring the epidemiology of recent HIV infections will allow the country to adjust the public health response to subpopulations and locations where high level of transmission may be occurring. However, this approach is still hampered by the stigma faced by people living with HIV. To support efforts to combat new infections, the Nigerian government and UNAIDS agreed at the meeting on March 12, 2024 to set up a support program for people living with the virus to enable them to integrate into the workforce and gain easier access to treatment.
Stigma and discrimination in the context of the AIDS response will increase people's vulnerability. AIDS will deter people, so to having access to services, so we may have health facilities around. You may have drugs, but because of the stigma and discrimination, especially from the healthcare professional, so they would not have access to those services. They would not take the pills, they would not be virally suppressed, and then they would die, or they continue in transmitting the infection.
Estimates from 2023 Spectrum placed the number of people living with HIV in Nigeria at 1,900,000. AIDS-related deaths in Nigeria have been estimated to be around 49,000 across all age groups in the year 2020 alone. Globally, Nigeria ranks third among the countries with the highest number of people living with HIV. These are over the years acted as a catalyst of antisocial cohesion, a situation the government tends to scold the population against.
We want to make sure by next year we attain 95, and we are determined to see that happen.
According to the National Agency for the Control of AIDS, more women than men are HIV positive in Nigeria. 906,000 women, equating to 56%, live with HIV/AIDS in Nigeria, while 650,000 men aged 15 and above live with the disease.